Thank you to everyone who's joined us. My name is Hallie Leinhart. I'm the Outreach Specialist for the Center for Financial Security here at the University of Wisconsin-Madison. Again, thank you so much for joining us for The Rise of Mortgages in Retirement, a webinar exploration of study findings and insights. Just to give a bit of a rundown on our format today, we will start with the research presentation and then we move into the discussant portions with representatives from AARP Foundation and the Elder Financial Safety Center with the senior source sharing insights. We will then continue with a question and answer session, so please feel free to submit questions in the box at the bottom of your screen throughout the webinar. I'm very excited to introduce our presenters for today's webinar. We have Eric Embry. He's Assistant Professor in the Department of Economics at the University of Illinois at Chicago. He's also a CFS Research Fellow. Paulin is Director of Income Security at the AARP Foundation. Julie Krozik with the Elder Financial Safety Center is Director of the Senior Source, and Debbie Burkham is with us from the Elder Financial Safety Center as well, and she is a financial coach at the Senior Source. Thank you all for being here today. And with that, we will get started with our presentations, and I will turn it over to Eric Embry.
Thank you, Hallie, and thank you everyone for being here. I'm excited to talk a bit about my research project here, The Rise of Mortgages in Retirement, and this is joint work with Michael Collins at the University of Wisconsin and Carly Urban at the Montana State University. So the basic idea of this project is we kind of have three goals that we're looking at. So first, we really want to document changes in mortgage usage over the life cycle that have happened over the past several decades. And in particular, we're going to focus on older households. So we're going to start off doing that, just documenting what has happened. And then we're going to look for possible reasons of what has caused this change in behavior, in particular a large increase in mortgage usage among seniors or older households. And then lastly, we're going to think about consequences or possible policy implications that we find. Maybe I don't have to motivate people here too much, but if you're wondering why you should care about mortgage usage by seniors, so housing is the largest expenditure for older households in the U.S., and it's also the greatest financial asset that they have. So it's a really important decision that they face about how much to spend on housing and whether to take out a mortgage or not. So about 80% of households over the age of 60 own their home, and home equity accounts for somewhere between 40 and 45% of the financial wealth of seniors. So it's a really large component of the household balance sheet. As we're thinking about this project, again, we're going to start off documenting that mortgage usage has really increased. But we're trying to think somewhat about, is this a good thing or a bad thing? Maybe it's neutral. And so just to get you thinking about it a little, increased mortgage usage could be a good sign if it's related to, say, mortgages being cheaper or easier to get than they used to be. It might be that in earlier times it was tougher for seniors to get a mortgage, and now it's just easier, and so that's good. It could be a result of there being more homeowners and in turn higher mortgage usage among seniors. Or it could be that life expectancy is increasing and so people just have a mortgage over a longer period of time throughout their life. But you also might worry that there could be bad implications from increased mortgage usage by seniors. So in particular, you might worry that taking out a mortgage is a signal that older households have lower wealth than they used to, or their finances are in a worse situation. It could be that the cost of other goods, such as like kids or medical care, are rising, and in response, they have to take out a mortgage to pay for these. And then the big worry is going to be that they're running through their cash kind of quicker than they would hope to, and at some point they'll run out and be in a bad situation. So like I said, we're going to start off, I'll spend about half the presentation, I think, documenting what's happened, and then the other half looking a bit at some possible causes and explanations. And so most of these graphs to start off with are based on census data, so these are really large samples of data, and we're going to be looking from the period 1980 to 2015. And so you'll see several of these graphs coming up that look like what's on the screen now, where on the x-axis you have the age of the household, and on the y-axis you have some outcome variable. So here we're looking at home ownership rate by age, and the solid dark line is the most recent time period, 2015, and the light dashed line is 1980, which is the furthest back in time we go. And so everything in between is kind of how things have shifted from 1980 to 2015. And so when we look at this age profile of home ownership and how that's changed over time, we see in aggregate there really hasn't been a whole lot of change in home ownership between 1980 to 2015. It's slightly lower at the moment than it used to be. But there has been big changes in the age profile of who is a homeowner. And so, something that's been reported a lot is that home ownership among younger households has been decreasing. So like an age 40 household in 1980 had a 71% chance of being a homeowner, and in 2015 that's dropped down to 64%. But if you look at older households, you see a large increase in home ownership, where in 1980 the home ownership rate among an age 70 household was 73%, and now that's up all the way to 84%. So we start off seeing a large increase in home ownership, and then if we look at the percent of households that have a mortgage, we see even larger increases. So in the left panel here, we have just all households. Again, looking at the age profile of whether you have a mortgage or not. And in the right panel, we're looking only among homeowners in that similar age mortgage profile. And so what we see here is a really large increase among older households in the prevalence of a mortgage. So in 1980, an age 70 household had only an 11% chance of having a mortgage, so 1 in 10 roughly. And by 2015, that's up to 35% of households age 70 that have a mortgage. So that's almost triple the rate of households having a mortgage, or an increase about 24%, or a quarter of all households that are 70 have a mortgage. So this is a really large increase, and we're really interested to look at why. And kind of what really stands out here too is when you look at all the years in between, it's been a really steady increase over time. So we're not going to be able to attribute this to kind of one-off experiences such as like the housing boom in the early 2000s or a response to the bust in the 2008 period. This has been a steady increase from 1980 to 90 to 2000 to 2015. All the while mortgage usage by younger households really hasn't changed a whole lot. So that same age 40 household has increased their mortgage usage only from like 48% to 53% over that 30-year period. So kind of a small increase among younger households, but a really large increase among older households. Okay. And so when we start looking at explanations, we want to think about what drives mortgage usage to begin with. And one of the main drivers or predictors of mortgage usage is income. And so here on the left panel, we see the percent of households that have a mortgage based on their income percentile. And so you see this really steep gradient where higher income households are much more likely to have a mortgage than lower income households. That's been relatively constant over time with kind of a level shift. Okay, so income is a big predictor of mortgage usage, but then in that right-hand panel there, what we do is we break out this age profile by income quartiles. And so in that top left panel, the panel 1, you see among low-income households, it's still the case that there's been this large increase in mortgage usage by older households, and the same is true for the bottom right panel there, the panel 4. The highest income households have also had a large increase in mortgage usage. So income by itself certainly isn't driving this change in mortgage usage over time by seniors. When we're looking at overall housing consumption, in the left-hand panel there, this is like how much what's the home value of, say, older households relative to younger households. And what we see here is that in 1980, an age 40 household lived in about a 30% more valuable home than an age 70 household. But by 2015, they're actually living in similarly valued households. So there has been a somewhat big change in the home value over the course of the life cycle, where in relative terms, older households are living in more similar houses to younger households or prime age households. But in the right-hand panel, when we compare that home value to income, to see kind of what's driving that relative difference, we see a lot of that change over time is that more related to younger households are living in more valuable homes relative to their income than older households. So most of this change that's occurring is because younger households are spending more on housing, and only some of it is because older households are spending more on housing. And so when we're looking at other possible explanations for what's causing this change over time, you might think that older households are moving more often than they used to, so maybe they originate a mortgage earlier or more often than they used to. But the left-hand panel here shows the probability of a household moving over the past 5 years. Again, looking at 2015 relative to 1980, we actually see a pretty significant decrease in the moving rates among seniors over time, so they're actually moving less often than they used to. And in the right-hand panel, we see what life expectancy looks like and how that's changed over time. And so while life expectancy has increased, again, if we take that age 70 household, in 2013, they can expect to live about 2 years longer on average than, say, that same household would have expected to live in 1980. So yes, they can live longer, but it's not a big difference relative to if you were predicting mortgage usage from adding another 2 years to life expectancy. And so that doesn't jump out as a big reason why mortgage usage is increasing among seniors. So there's a bunch of other possible explanations that we can kind of look at here that I won't show you. Reverse mortgages is another thing people often bring up, and that's certainly a growing segment of the markets, especially over the past decade or so, but it's actually a relatively small component of mortgage usage among seniors, so we also couldn't attribute it to reverse mortgages. And then lastly for our trends here, this is showing wealth by age, looking at households in kind of the late 90s relative to the mid-2000s to the later 2000s. And we see that conditional on reaching age 70, net wealth is actually pretty similar across these cohorts. What's changed is how that wealth has increased over the life cycle, where kind of more recently households are saving a lot in those last few years before retirement between age 50 and age 70, and there wasn't as much of that going on earlier. But once you turn 70, we actually don't see a large decrease in wealth by age here. Okay, so what our study is doing is we're drawing from 3 different data sets. They all kind of have their unique benefits, and we're going to be using them to try and see what is predicting changes in mortgage usage over time. So one of this is the Health and Retirement Study, or the HRS data, and its big benefit is that it's panel data, so that we're able to observe the same household over time. And this data goes back to about 1994 at the earliest and through 2014. We're also going to use census data combined with the American Community Survey, and its big advantage is that it has a lot of data, so we get about 500,000 observations a year here, and it goes back really far too, so we're able to go all the way back to 1980 here and up through 2015. And lastly, we're also going to use the Survey of Consumer Finances, and the benefit of that data set is going to be that it has the best information on wealth and finances, so it has really detailed information on wealth and finances, and we're going to exploit that as well. The empirical strategy we're using here, this is the equation that we're going to estimate, but essentially the idea is we're going to control for a bunch of possible observable characteristics that might predict mortgage usage, things like number of children, your income, your marital status, your race, your education, all those things. We're going to include state fixed effects and household fixed effects when we have panel data. So we're looking at like within the same state over time, how is mortgage usage changing? And then what we're focusing on are these A2 and A3 variables. And so what that's doing is it's saying, how is mortgage usage among households aged either 65 to 79 for the A2 variable or age 80 and above for the A3 variable? How is mortgage usage among those groups changing relative to households that are age 50 to 64, so people who are kind of in that pre-retirement age still. So we're looking at relative differences across the age cycle here. And then we're also going to add in some other control variables as we go along to try and control for things like health and bequest motives or wealth or other aggregate macroeconomic variables that could explain mortgage usage. And so what I'm going to show you next is kind of our primary output, and what that's going to do is it estimates that equation 1 for each year in each of our 3 data sets. And so again, what it's going to be showing is like the relative mortgage usage by these older households relative to that younger cohort of 50 to 64-year-old households. And so I'm showing down here at the bottom what the raw difference in mortgage usage is by these different age groups. So for example, age 64 to 79-year-old households in 1980 were 21 percentage points less likely to have a mortgage than age 50 to 64. And then you can kind of see how that changes across time and age group there as just a raw difference. And then what this table shows us here is for each of the 3 data sets, first at the top the HRS, in the middle is the census, and at the bottom is the Survey of Consumer Finances. For each year there, it's showing after you control for observables and have those state and household fixed effects, now what is the difference between those kind of 50 to 64-year-olds and 65 to 79 or 80 and above households. And so what we see here is when you control for observable characteristics, you can explain about a third or a half of the aggregate difference in mortgage usage across these groups. So observables can tell us something or a fair amount about how mortgage usage across those groups is changing. But what it doesn't do is tell us what's changing between, say, 1980 and 2015. And so what observables do is it tells us why, in general, age 65 to 79-year-olds have lower mortgage usage than 50 to 64, but it doesn't help explain those changes in those observables over time, doesn't change the difference between kind of the raw and the adjusted numbers. And so so what this is telling us is that like change in number of kids or urban versus rural or all those observable characteristics aren't showing changes in mortgage usage over time in kind of this relative group. In this next set of results, we are adding in those additional control variables to try and see if they can help predict mortgage usage as well. And so what this includes is a subjective health measure. It asks the individual what they think the probability that they'll live to, say, age 85 is, and it includes the overall household wealth in that top panel. But we see actually pretty similar, not quite identical, but pretty similar results as what we had in the previous table. And then at the bottom, 2 panels, we include a bequest motive, again, in a survey question about whether they plan to leave a bequest or not. And in the very bottom panel, we include macroeconomic variables like how house prices are changing or unemployment or whether you're allowed to have the state mortgage interest deduction. And again, all of these control variables can help us explain a little bit more of the aggregate difference across age groups in mortgage usage, but doesn't really tell us how these things are changing over time. So what we also wanted to do was look for heterogeneity across some of these demographic and financial characteristics in mortgage usage. So by if you have kids or not, if you have a pension, your education level, and your net worth. And we have to use the Survey of Consumer Finance data for that. And so that's what we have here. And so in these graphs, the blue line represents like whether you have kids in the top left graph, whether you don't have a pension, whether you have less than a high school education, or whether you have greater than median net household wealth in that bottom right panel. And then the green line is the other group, like if you don't have kids or you do have a pension or greater than a high school education. And so we see somewhat different trends by these different demographic groups. And in particular, since the mid-90s, we see a much larger gain in mortgage usage among those who don't have a pension or for those who have lower wealth or below median wealth. Our study also looks at a number of other outcomes that I'm not going to be able to show you here. We look at predicting overall home ownership or mortgage conditional on home ownership. But overall, we get kind of same trends and differences by age groups over time using alternative outcomes. We also look at whether or not you have a second home or an investor property, and that can explain about 3 to 4 percentage points of that mortgage change over time. It is more likely that older households have a second mortgage or an investor property. And then if we look at the home value, we do see an increase by about 10% of housing consumption. So it is true that older households are living in more valuable homes than they used to, and that could explain mortgage usage as well, that they need to take a mortgage to live in this more expensive house. When we look at outcomes in financial sense, we see that older households have lower liquid savings than they used to. So compared to 1989 relative to present, that 65 to 79-year-old age group has about $10,000 less in liquid savings relative to that 50 to 64 group than they used to. But they also have less debt than they used to, which is about $15,000 less in debt. So kind of the net total between savings and debt is positive for this group of households. And if we look at delinquency, we see that they're actually less likely to be delinquent on debt than they used to be, or older households used to be. So we see that as a positive. So overall, we see this trend of, yes, there is less liquid savings, but there's also less total debt, and they're less likely to be delinquent on debt payments. So we at least don't see that as bad news necessarily for these households. So to just kind of summarize the housing trends that we found, we see that there's been a really large increase in mortgage usage among seniors, almost triple what mortgage usage used to be among households aged 65 and above. And this increase has been really steady across years and across income groups over time. We see that housing consumption and longevity has increased and that moving has decreased as well. So these can explain part of the trend, but there's a lot left unexplained at this point. And then to just kind of summarize our findings so far, we see that some of this aggregate mortgage use trend can be explained by observables, but not much of the relative change across age groups. So we're still trying to understand that difference. And we see some of that difference being driven by those without pensions or lower net wealth, which is maybe expected, where if you don't have that pension income coming in, you need another source of income every month to help. And we also see some of it driven by increased second homes, but not too much. But overall, we at least don't see evidence that there's a large negative effect so far of increased mortgage usage among older households. So anyway, that's where we're at so far with the study. And so for now, I'll hand it over to Paolo.
Hi, everyone. My name is Paulin. I am the Director of Income Security at the AARP Foundation. Thank you so much for attending this webinar, and thank you, Eric, for your research and your findings. What I want to do is really take a look at it more from a kind of a practitioner perspective, and specifically look at some of the things that we're finding as we serve the older adults in the marketplace, and the approach that we take in looking for solutions to some of the issues around income security and economic security. So before I do that, I'll just go through a quick overview of the foundation, talk a little bit about the kind of the way we look at how to address those particular challenges. I'll give you a brief overview of our our process, and then talk very quickly about our insights about some of the projects that we're currently looking or that we're currently piloting or you're looking at piloting or piloting today based on the research that Eric and others have done and how we have to address that in the particular marketplace. So very quickly, I'm obviously with the AARP Foundation. AARP Foundation serves the vulnerable 50-plus population, so we typically look at people who are 50 and older that are low income, and low income for us is defined as 250% of the poverty level. And we serve that population by creating and advancing effective solutions that help them secure essentials. When we look at essentials, we're looking across 4 different impact areas or 4 different areas. Housing security is the first area. Income security is the second area. Food security, and then social isolation being the 4th area. And we generally look at solutions that are interdisciplinary across those 4 different impact areas. When we talk about effective solutions, we look at things that have third-party research that supports a particular intervention and also have real impact at scale. And scale is different depending on the area that we focus on, whether it's housing or whether it's income or social isolation. But we're generally targeting roughly around 3 million people per year where our interventions can produce a positive outcome, and we measure the positive outcomes from those specific interventions. The way we've approached that has been a bit of a transformation within the foundation over the last several years. We've applied human-centered design as a process to apply kind of a scientific method to social entrepreneurship so that we can learn very quickly, to do it also very, very cost-effectively, and then use that to be able to decide whether or not it can be an effective solution, and then we fund and scale that solution over a 3-year period and continue to reassess that every 3 years formally, but literally every quarter. So I wanted to give you a little bit of context of what that process is before I work into our insights. To frame that, we look at obviously kind of leveraging the research and a lot of the research that people like Eric have produced, and apply that research to give us clues about what we need to do next to be able to address these particular needs. So the first fact that we obviously have to address is that America is in fact aging. By 2030, the U.S. population age 50 or over will increase to 132 million people. And then the adults aged 65 to 74 will nearly double from 21.7 million to about 38.6 million by 2030. So America is aging. We then have to figure out how that impacts the solutions and how we address those particular solutions. So by 2030, 1 in 5 people in the United States will be over 65, and then 1 in 8 will be over 75. Is to give you context of how we are kind of framing the size of our marketplace and how we're going to define our solutions around there. And as Eric has talked about as well, there is the high cost of housing. We look at housing both from a homeowner perspective, which obviously Eric focused on, as well as from a renter perspective. I'll focus today mostly on the homeowner perspective to stay in theme of this particular presentation. And if you look at ownership versus renters, homeowners over 65 can afford in-home assistance for nearly 9 years or 6.5 years of assisted living versus the typical renter, and that mirrors Eric's research in terms of kind of the wealth of the older American is very much built into their housing, and there's some positive outcomes based on that. And one of them is to be able to afford assisted living and be able to stay and age in home much longer than a renter. And in 2012, so we look at 2012 numbers, 1/3 of adults aged 50 and over, so nearly 20 million households, paid more than 30% of their incomes for housing. And she's from Eric's research, it's increasing, including nearly 9.6 million who paid more than 50% of their income in housing. That changes as you look at older Americans who are low income. And this is just the median income LMI numbers at this particular point. Not going to talk so much about the housing assistance gap, but there obviously is a gap, specifically in renters. There's a need of 3.9 million and a supply of 1.4 million. So there's a significant gap that we have to address in terms of housing security in particular. Sometimes we look at processes and we look at different services, and we think it might be a process or system issue, but in many cases it could be just a carpentry issue, right? There are just less houses and less assistance that are available for people out there. Specifically for low-income folks, older adults, because of the higher housing costs, they're going to have to cut back on other things. So they're cutting back on food. Households are spending more than half their income on housing, spend over 40% less on food, and that then makes them more food insecure. From a healthcare perspective, the burden is also pretty significant. From the 50-64 age group, they spend 70% less on healthcare due to the rising costs of housing. And from a savings perspective as well, they are saving less overall. And again, I'm specifically focused on low-income households, and not general older Americans over 50. So given that context, my challenge at the foundation and the team's challenge is to be able to design effective solutions to be able to meet the needs of those struggling adults. We have design principles that we've applied to this using human-centered design. So the first design principle is that we want it to be a low or declining marginal cost in order to scale. So the more people that we provide the intervention to, the lower marginal costs as we increase the number of people we serve is a challenge that we have to look at as when we design a particular solution. The second, and I know there are several or a lot of other nonprofits in the webinar, is because we don't charge for our services, we have to identify a third-party beneficiary that's going to be necessary for funding. So the solution has to be able to have a shared value with someone else in the marketplace that's willing to pay for this particular intervention because it benefits them by doing so. In many cases, it's the federal government, but also we partner very much with financial institutions, banks, insurance companies, hospitals, and so forth because of the correlation between health and wealth. The third is that aging affects both rich and poor. So when you look at our solutions, while you're a low-income person, you may not pay for it. The solution also, however, has to scale so that in the event that you are not low-income, then you may be able to pay for those particular services when they are in fact relevant. And then the fourth principle is it's usually more cost-effective and greater impact to target a problem earlier rather than later. And lastly is that we use our brand to be able to obviously scale and reach that. So that's generally what our design principles look like. The next slide you see here is just kind of looking at what our human-centered process looks like. We have a quarterly schedule that actually is deployed throughout the particular year where we have time to be able to look at an intervention on the field, do some insight gatherings, interview a lot of folks where they are affected by a particular problem. We use third-party evaluation from a review perspective, and then all the way through until we get to leadership review, so we are able to move a solution across our foundation, at least 3 solutions on a yearly basis, and if you work on timing across the particular year, hopefully we're launching a solution every quarter. And then the next slide that I'm showing you here is just kind of what that decision-making process looks like from our particular and how we deploy our human-centered design. The first component of that is what we call a customer discovery module. This is where we're trying to find out strategically whether it meets our objective and there's an evidence of need. That then moves on to a sprint module where we look to see is there in fact demand for the intervention. And then the third module is can we scale this particular solution. So many of you obviously apply human-centered design. We've just taken that, made the process in terms of how we fund that across the foundation to be able to scale out these solutions on a defined way. So what did we find and what are our particular insights? And I'll stop on this particular slide and then turn it over to Julie next, but I'll talk a little bit about our insights and some of the things that we're working on based on what we found. So the first is that there obviously is a demand for income. The older Americans, specifically the low-income older Americans, are not able to make ends meet. Their mortgages are taking a larger portion of their particular income, and so they need to be able to supplement that in several ways. We're looking at that 3 different programs that are specific to driving additional income. One is there potential to actually make that asset an income-producing asset, make the home an income-producing asset by building auxiliary dwelling units where the older adult potentially converts a garage into a dwelling unit that they end up renting a la Airbnb, or actually developing a freestanding unit in the backyard of their particular property and rent that. And we've seen demand for that, at least from our field work, that about 57% of the folks that we talk to are interested in a solution like this. There are implications about how this works from a policy perspective, obviously from a zoning standpoint, and then from a mortgage perspective and how the ADUs are actually funded either through reverse mortgages or through some other innovative ways to be able to fund that particular unit where it becomes less risk for the low-income older American to be able to take advantage of that. Second is that we're looking at a traditional Airbnb type of model, but something a bit more stable, where seniors rent rooms to college students, and we're going through a innovation process right now to identify whether that's a valid solution that we can deploy in the marketplace. And then the fifth point that I have on the slide here is looking at additional ways to increase income through Encore entrepreneurship, being able to de-risk entrepreneurship for older Americans, specifically low-income older Americans, to be able to support them throughout that particular process. Today, our results are showing that roughly around 2,500 participants were able to generate about $1 million in new revenue per year, new income per year for the people that we're serving, and we're looking at opportunities to be able to scale that to a much larger number as we continue to support entrepreneurship for seniors in the next several years, next several iterations of our particular project. The other 2 programs that we're looking at from an insight perspective is how do we increase savings, obviously, for the low-income older American, where you have significant pressures, as Eric talked about, and as I've seen in our slides, around not only food, but also around medical costs. So we're looking at programs around that, as well as, because the home is their largest asset, how do we keep them in the home, and how do we keep the home a great asset and not a declining asset based on disrepair, so home repair for seniors to be able to age in place. With that, I will turn it over to Julie.
All right. Well, thank you, Paulo. Well, we are excited and thrilled to be a part of this conversation, especially since we think our center is actually a scalable solution to the issue of economic security for older adults. I'm Julie Krozik, Director of the Elder Financial Safety Center, and I'm joined by Debbie Burkham, who is really our expert on housing, mortgages, reverse mortgages, credit and debt repair. And so I'll share a little bit about our center and what we do, and Debbie will talk more specifically about some of the work we do, how it applies to the research, and some of the services we provide here in Dallas County for our older adults. And so with that, the Elder Financial Safety Center is the first of its kind center in the nation. We actually are a collaborative partnership with the Senior Source, and the Senior Source is the largest aging nonprofit in North Texas. We serve older adults 50 and over, and we've done that for 57 years through 8 programs. Our other collaborator is Dallas County Probate Courts and District Attorney's Office, and as a collaborative, we offer comprehensive prevention, protection, and prosecution services to address all aspects of an older adult's economic security. And you know, when we launched the center back in May of 2014, it was with the belief that financial security is the gateway issue to public safety for older adults. Now today, about 4 in our 5th year, find that still to be true. And what we know for sure is that our older adults, they want to live in a safe community. They want to be independent if possible and as long as possible. They really do want financial protection and protection from physical harm as they age. They become more vulnerable, and this is their sentiments, not just ours. And what we also have learned is that they will risk absolutely everything to keep their home and maintain their housing situation. And, you know, some of the things we have seen after working with thousands of older adults over the past 4 years, and this alludes back to Paulo's slide on the housing assistance gap, is that older adults will actually choose to give up food. Often then we'll see transportation go away. They'll give up their transportation. And then usually they'll give up their medication or whatever medical care they might need, and usually are very unwilling to talk about giving up their homes. It's a last-ditch resort. And Debbie's going to talk a little bit more in a few minutes about some of those factors. What I want to do, though, is just share with you just a quick overview of some of our services, and so you can see what we offer here at the Senior Source through the prevention services of the Elder Financial Safety Center. I'm sharing this with you because the prevention services have been the fastest growing component of the center since 2014. And so to kind of put that in perspective, we anticipated serving 3,700 older adults in a 5-year period. And just last year alone, we served over 4,122 older adults. And for us, that was a 19% increase in our service delivery from 2016. And so I think it really speaks well to Eric's research and, more importantly, to the economic security need out there and the need to address it for our older adults. Also, we know that prevention services are the fastest growing component because regardless of where an older adult is in the process, all roads can come back to prevention. And so to give you an example of that, if we had an older adult who perhaps was needing a guardianship through the probate courts, but found themselves victimized of frauds or scams, not only would they be working with probate court for the guardianship process at the same time, they'd be working with us so that we could help them address whatever exploitation, fraud, or scam situation they were involved with to determine what is the most appropriate resource for them. It's not always the district attorney's office. And so as far as we know, we're the only organization in the country that does one-on-one frauds and scams advocacy and actually walks an older adult through every step of the process, whether that's an identity theft affidavit, filing a police report, completing the affidavit with the district attorney's office, or whatever the case may be. And so I think that's why we've seen such huge increase over the past several years, along with the fact that it's just a real need for our older adults. Also, to kind of help you understand who we serve adults 50 and over of any income level. We don't charge for our services here at the Elder Financial Safety Center. But to kind of help you understand, our typical client is normally an African-American woman in her late 60s, early 70s, and again, primarily our older adults are low to moderate income. So before you hear from Debbie, I'm just really proud to share with all of you our impact since 2014, and this is a collective impact for the Elder Financial Safety Center that includes the Senior Source, Dallas County Probate Courts, and District Attorney's Office. You can see we've served over 16,000 older adults since 2014, and those are unduplicated numbers, which I think is important to know. We've empowered or educated over 30,000 across the nation, so not only do we present on the financial literacy topics, talk about financial exploitation prevention, but we travel around the country meeting with communities to talk about how we have a scalable solution to address the economic security of older adults. And we advocate for centers across the country. And then you can see that we've secured $75 million for Dallas County through our prevention, protection, and prosecution services. And so to kind of give you a taste of what that might be, it could be that we've helped an older adult increase their savings, decrease their expenses. That could be asset protection or restitution. Of course, we help older adults secure employment and public benefits and so much more. And so we're just really proud of the work that we're doing. But Debbie really has all the good information on the specifics related not just to the research but our services. And so with that, I will turn it over to Debbie.
Thank you, Julie, and thank you for inviting us to join in on this webinar. I'm very excited to be here. I really could talk all day on this topic of housing, but we don't have that much time, so I'll just kind of highlight some of the things that we see here at the Elder Financial Safety Center through our counseling and coaching and education. One of the things that is hypothesized in this research is that bequest motives have changed as older adults are financially assisting and supporting their grown children. And we support this belief, and we see it all the time here at the Elder Financial Safety Center. Whether or not the older adult had intentions of leaving behind an inheritance for their family members, we are definitely seeing that more clients are supporting their adult children as a result of unemployment or underemployment. Possibly that adult child has become disabled or they've experienced some changes in their own marital status. And so as these adult children are moving back into the home with their parents, they're often bringing their own children with them. And the financial burden of supporting these extended families is falling on the older adult because they typically are the ones who have the more stable source of income and a more stable housing arrangement. And so what's happening, or what we're seeing happen, is that these clients are tapping into the equity in their homes. They're either doing that through reverse mortgages to increase their income, or they're using reverse mortgages as a way to eliminate an existing mortgage payment. Some of these older adults have refinanced their homes that were either paid off or nearly paid off, and what we're seeing is that they're extending these mortgage notes out over a longer period of time, extending those maturity dates to make their payments more affordable to accommodate for higher expenses of these extended families. And also for some of these older adults, the financial burden has become so great that they have defaulted or fallen behind on mortgage payments. And when that happens, the only real option they have, if they really want to stay in the home, is to seek hardship options through mortgage modifications. And these mortgage modifications, if approved, usually result in, again, a longer mortgage note by extending out that maturity date. One of the other things that we know to be true about older adults, and we see this at the Elder Financial Safety Center, is that our clients, our older adults, want to age in place. Moving really is not an option that they want to consider. They have become familiar with their surroundings, so much so that they really don't want to leave. Their physical limitations and this familiarity seems to influence their decision, if not as much or more than the financial considerations of moving. So the home has essentially become the center of their world, and from this hub, they are able to still exercise some autonomy, and they can still navigate within the community, within their comfort zone, to obtain their goods and services. They, attend church. Their health care providers are nearby. The stores that they like to shop at are nearby. And so they really don't want to get outside of this comfort zone. This is especially true for the elder orphans, so to speak. They may not have family or other support networks available to them. This could be due to estrangement from family. It could be due to displacement of family members who have moved out to other states and are not nearby. And it could also be due to their own longevity. They're living longer and just wanting to stay in place rather than leaving and seeking housing through assisted living or some other means. And so in order to remain in the home, these older adults are tapping into various types of mortgage financing, and they're utilizing this to either repair their homes, they're making improvements to their home, or they're just trying to maintain their homes because community funding is just not really available for these services, such as what's called a deferred payment loan. These are loan types that are typically offered through county governments, city governments, or state governments. And this type of funding is just not as available as maybe it once was. And so these homeowners are having to utilize their own home equity to accomplish these needs. And finally, one very sad but true reality is that in some cases we're seeing that adult family members are encouraging their older adult parents to take on mortgage debt. And so for an example here, you may have a younger adult. They perhaps are not credit worthy, and they may not have saved money for down payments. So they're going to their parents, and they're asking these parents to help them purchase a home. And this family member is asking the parent to help them with down payment, co-sign on these notes, and oftentimes what happens is the younger child, they are finding themselves where their life is making a change. Either they're getting married, maybe they are finding jobs in other places. And so now you have this older adult who has taken on a mortgage debt to move in with their adult child, and the adult child is moving on. And they're leaving the parent behind, and the parent is now left in a home alone and saddled with this mortgage note that they're struggling to try and keep up. And so the next slide here, we just want to kind of talk about how we here at the Elder Financial Safety Center are trying to meet the need here in Dallas County. We have a number of prevention services we offer one-on-one financial coaching and counseling, and that may be for an extended period of time, whether our older adult client needs, 6 or 8 sessions to kind of work through their situation and achieve their goals. It could be that the older adult is just needing a couple of sessions to gather some information and resources, and they are empowered then to go out and tackle whatever need that they have. And we also have individual education. This is through various courses or classes that may be offered. We do have our employment services, and so many of our older adult clients can improve their skill sets through these classes that are offered, individualized sessions with to help them learn how to prepare resumes, to help them learn how to prepare for interviews, networking events, if their goal is to supplement their income and kind of improve their financial situation that way. We're also providing through our Money Smart for Older Adults class. This is a group education course, and it's been very popular and well received. We use we build upon a curriculum that's offered through the FDIC and the CFPB, Consumer Financial Protection Bureau. And this class, we build on that. It's a 5-week course, and we meet once a week, and we cover anything that has to do with financial security and helping older adults to protect that financial security and prepare for their needs as they age. And we also wanted to just kind of touch on our community partnerships. As was mentioned earlier by Julie, we do collaborate with the District Attorney's Office and the probate courts, but we also collaborate with other nonprofits to provide a variety of services. One of the things that we've seen in our area, and especially with some of our lower income older adults, is that to make ends meet, they're utilizing high interest payday loans and title loans, and so we have started a pilot program to address those needs to help these older adults get out of this cycle of making these high payments on these predatory type loans. So we've offered a mini loan program where they have a low interest rate. They must go through a financial coaching over a 12-month period. And then the next goal after they have paid off that loan is to help them establish a regular savings to prepare for any unexpected expenses that may come up. And we also offer housing counseling, debt management, credit counseling through partnerships with other nonprofits. And we're just really the one-stop shopping, so to speak, where we provide all these services here at our location, and for some of our older adults who may be homebound, if needed, we can go into the community and visit with them and address their needs that way. And it's just a very all-inclusive, holistic approach. We're helping these older adults tap into other things like benefits if they have not accessed those yet. And it's just a really great program, and it's just great to be a part of the center here and see how we are impacting the lives of these older adults in Dallas County. And so now I'd just like to turn it back over to Hallie for question and answer.
Perfect. Thank you so much, Debbie. Thanks, Julie. Thanks, Paulo. Thanks, Eric. And I'm going to break my own rule just a tiny bit and just take a couple questions, even though I know we're coming to the end of the hour. Just want everybody to know this is being recorded, so I will post it afterwards. So I'm going to get in just a couple questions that I think will provide some clarity and be quite beneficial to this conversation. So, Eric, first off, I just wanted to ask if there was any kind of regional trends that you see in terms of the mortgage loans and the debt loads in terms of mortgages. Were you able to do any regional analysis?
Yeah, so we have broken it out by region. It is true that overall areas that have higher home values in general also have higher mortgage usage. So that's certainly true, but we haven't necessarily seen too much differential response by region if you control for house price changes. So that part hasn't changed, but it is true, like higher home values do in general lead to higher mortgage usage, and that's certainly true among seniors.
Okay, excellent. And then I am going to direct a question to Julie and Debbie. And this is regarding your services that you outlined, which sound excellent, and I think this is probably a very helpful kind of program overview for organizations that are on the call today that are interested in providing services like this specifically to seniors. And so one of the questions that we have is regarding barriers to accessing services, and that we always see barriers to accessing services when we're talking about vulnerable populations, but I would assume that in the situation of providing services to seniors, to elderly people, that you would experience that barrier of accessing, of actually reaching the services at even higher rates. So are there any kind of mobile or remote services provided, or how do you get past that barrier that we would assume would be higher for this population?
Yeah, that's a great question. I think that we work really hard to remove any barrier. This is Julie, by the way. Any barrier that exists. So as Debbie mentioned, when there's homebound seniors, we do go into the home. For older adults who need more intensive case management, we have trained and vetted volunteers through our money management program that go into the homes 2 or more times a month. We actually, through our district attorney's office here, they have satellite offices, and so we can office from any of those satellite offices, especially in our most vulnerable communities here in Dallas County. And then through some of our partnerships, we actually go try to find partners in the most underserved areas of the community and provide services on site once or twice a month. And that's either some of the financial services or employment services, whatever it may be. We can do quite a bit of work over the phone if that's the only way that the older adult can be served in the moment. And again, we just make it work however it works for the older adult, because all of our efforts and services are individually based on what the adult needs. And so, of course, it's a lot of work, but well worth it. And as Debbie mentioned about our Money Smart classes, we try to host those in the community, again, in areas we don't typically have as much access to, and so that's been really successful at helping us gain access to older adults who need our services and taking it to their community. So again, that creates the access.
Great, thank you so much. And I'm going to just fit in one more question directed at Paulo, and this is regarding you spoke about how AARP really strives to take a multidisciplinary approach to the various obstacles and the areas of need that you have specified for older adults, housing. You mentioned several. Can you provide an example of a way that you are combining the housing kind of difficulties that we have talked about today for seniors, and then another area of difficulty, for instance, I can't remember exactly what you had stated as the other areas, but perhaps medical issues or maybe food insecurity, things like that?
Yeah, absolutely. Thanks for the question. So the one I'll highlight is there's a close relationship across all 4 disciplines, income, food security, and social isolation. And then what I'll talk about is a closer relationship between kind of housing as well as isolation. As Julie had mentioned, the goal of many seniors or older adults are to age in place, and some of the problems with aging in place is their family members move away, and other access to services can also be much more difficult. So there's a chance of becoming both socially isolated as well as also loneliness are two factors around that. So one of the projects we're looking at today is a combination of using something similar to a TaskRabbit, if those of you familiar with TaskRabbit, and combining that with Amazon Alexa or Google Home, where we can then measure the interaction, allowing the older adult to get access to services through voice, but also then measuring the social isolation of an older adult through Duke's Social Isolation Index. So that's an example of how we're developing an innovation that combines 2 different disciplines for us, or what we call impact areas.
Great, thanks so much for that. And with that, I will bring us to a close. Really just want to thank Eric Embry, Paolo Narciso, Julie Krozik, and Debbie Burkham for your presentations today. And thanks so much to our audience for tuning in and then sticking around a little bit longer so that we could get some of those really great and interesting questions in. And just a reminder, this webinar was recorded, so we'll be posting this on our website later today with the PowerPoint slides as well. And I also wanted to alert everyone to an upcoming webinar that will be taking place during Money Smart Week in April. The webinar is titled The Effects of Access to Banking Services on Elementary Students' Financial Learning, a Field Study. And so please look for a registration email coming in the next week or 2. And again, I just want to thank everyone for tuning in today and to our presenters, and enjoy the rest of your day. Thank you.